Let's talk about marrow-sparing cancer drugs. Bone marrow toxicity is one of the major life-threatening adverse effects of many cancer drugs. Cytotoxic agents with minimum myelosuppression are termed as marrow-sparing drugs. Sparing here means saving. In a combination chemotherapy, it is very important to select a marrow-saving agent when one or more drugs in the list cause myelosuppression. Three most frequently used marrow-sparing drugs are vincristine, a vinca alkaloid, cisplatin, a platinum analog, and bleomycin, a non-anthracycline antibiotic. Out of all the three, vincristine is the most effective marrow-sparing chemotherapy agent in this order. Okay? Methotrexate, a folic acid antagonist, causes severe bone marrow toxicity due to folic acid depletion. When you add leucovorin, you can save these cells. Keep in mind, with leucovorin, methotrexate causes least myelosuppression. When you study these drugs, I want you to differentiate them with two other drugs, vinblastine and busulfan. Vinblastine is a microtubule inhibitor or vinca alkaloid like vincristine. Both are in the same class. But vinblastine causes severe marrow suppression. Vinblastine, how I remember is, vinblastine blasts the marrow while vincristine saves the marrow. Or you can remember by Christ the Savior, whichever mnemonic, whichever convenient for you. Please remember and distinguish those two drugs, okay? Then the busulfan also causes complete myelosuppression. But I want you to distinguish that from bleomycin. The reason is, of course, these two are from different classes of drug. For example, bleomycin is an anti-cancer antibiotic, but busulfan is an alkylating agent. But these two drugs cause similar adverse effects, like both cause bone marrow, pulmonary fibrosis. Remember? So both of these drugs cause pulmonary fibrosis, but bleomycin is a marrow-saving drug and busulfan is a bone marrow inhibitor or completely inhibit the bone marrow or myelosuppression. Okay? Let's look at a question. Post-treatment with a leucovorin reduces the bone marrow toxicity of which of the following drugs? Choices are 5-fluorouracil, vinblastine, vincristine, methotrexate. Okay, since we learned now, it's going to be easy for you. But when during the exam time, this may confuse you. A reason? Leucovorin can be given with a 5-fluorouracil and also with a methotrexate. But both of these are entirely different function. So let's look at it. With a 5-fluorouracil, leucovorin is given, but that time it's going to increase the toxicity of the drug, toxicity of 5-fluorouracil. But methotrexate, it is given to decrease the toxicity, reduce the bone marrow toxicity. One more time. With 5-fluorouracil, leucovorin is going to help to kill all the cancer cells. But with a methotrexate, it's actually given just after 24 hours of administration of methotrexate, high dose methotrexate, then we will give leucovorin. That time, leucovorin helped to save the normal cells, not cancer cell. Cancer cells are killed by the methotrexate, but to save our normal body cells, we are going to give folinic acid or folic acid, leucovorin. Remember, methotrexate is an antifolate, so it's going to starve all the cancer cells so that they will die without folate. But when you add after 24-hour leucovorin, we are going to feed our normal cells with a folic acid. It's in the form of folinic acid. So cancer cells cannot transport folinic acid. They don't have folinic acid transporter. Therefore, we can kill the cancer cells and save our bone marrow cells. Hope this is clear. Okay. So the answer is methotrexate. Then next question is 22-year-old female receiving a combination therapy needs bone marrow sparing chemotherapy agent. The oncologist used a drug which can kill which kills the cancer cells by inhibiting microtubules. That means a patient needed a bone marrow sparing drug. Oncologist used this drug which can kill the cancer cells by inhibiting microtubules. The question is, which is the drug? So answer choices: bleomycin, paclitaxel, vinblastine, or vincristine. So bleomycin is not an answer. Of course, bleomycin is a bone marrow sparing drug, but it's going to inhibit the DNA of the cancer cells. That means it's going to affect the break the phosphodiester bond of the DNA, and so that DNA of the cancer cells undergoes fragmentation. That's how you kill with a bleomycin. Then the next three drugs, paclitaxel, vinblastine, and vincristine, all the three drugs are microtubule inhibitors. Okay, paclitaxel is a taxane, but vinblastine and vincristine are vinca alkaloids. But out of this, paclitaxel and vinblastine can suppress the bone marrow, or myelosuppression is common for these drugs, but vincristine is the bone marrow saving drug. Okay, you already know that, but understand, I will make another video for mechanism of actions. Okay, hope this helps. All the best.